Good morning, I'm Dr. John Bennett, broadcasting from Miami Beach. We have the honor of hosting the UHA's Neurosurgery Grand Rounds. And I'll let UHA introduce our Giuseppe Lanzino, who's speaking today. Welcome, UHA.
Yeah. Thank you, John. So I share my screen. Hello, everybody. So we have the honor to have Giuseppe Lanzino here, and he's certainly one of the most creative, productive, and critical hybrid cerebrovascular neurosurgeons in the world. Has big influence on all of us. Works as professor at Mayo Clinic, Rochester, Minnesota, USA. Has long time experience. Has more than 800 high-level publications in high-level journals, maybe even more now, like we heard. Weekends, evenings are used for writing. He's excellent in writing, giving speeches, lectures, but also in the clinical practice. We have been friends since 20 years, since his first visit in Helsinki, and then we have had bilateral meetings, and he has been also here in China at our hospital, Henan Provincial People's Hospital. So this is the question: how to become a good neurosurgeon, international neurosurgeon, famous neurosurgeon. Learn English and publish. It remains so that English will be the language of scientific world, and we have to adapt everywhere, however common our own language is. There's this old sentence, publish or perish. It works in many countries, but in many countries it's not necessary to publish, but there are several reasons to publish, and I will speak a little bit about my experience, and then we take the start to tell how it is done. And Giuseppe will tell how everything is done. I tell about my struggling in publishing. How to begin publishing as a young medical doctor? Begin with small articles. For example, case reports. There is nothing harder than to write. We all love surgeries, but we have to sit down to write. There's only one thing that is harder in neurosurgical life. This is doing databases, and this is even more harder than writing, but writing is hard job. And then when you have done your best and sent your paper, it will be rejected, maybe accepted. You have to continue, rewrite as long, it will be published. Of course, the idea of your paper must be good. My own experience, I made my PhD in Helsinki when finishing my neurosurgical training, and then I was only operating on 10 years without writing. But then I noted that without publishing, I will never go forward, and I will stay at the same place. So I began to write. I sat down, evenings, weekends. It took 3 years of hard writing to learn to write well. Papers were rejected, I was down, then many changes were needed in some papers, and then they were accepted. And suddenly, from our small team in Eastern Finland, many of the papers were accepted. So we learned to write, we learned scientific writing, and this is important. So you learned scientific English, even your language is different. So how to begin publishing? For large articles, you need proper exact data. in clinical papers, you need databases and good follow-up. So you need exact knowledge of your material. You cannot write from your head down something. You have to sit down and begin to write. And this is hard working. Evenings, weekends, don't give up. Read how others are writing, don't copy. This is very dangerous nowadays because you can do copy and paste, but this will be found out. There is a structure in scientific writing, and you have to find out how scientific papers are written. You should circulate your writings, show your writing to others. You shouldn't find all help around you, and remember that also in the authors list. You will never lose anything by sharing and showing your writing. You get critical comments, and others' help is needed. We had at the end of my time in Helsinki, we had the so-called Helsinki machine. We had good fellows, young neurosurgeons. We had a team of good experienced writers who were checking everything what was written. So they were supporting this large team, and we could do in the last year 100 papers in 1 year. If your English is poor, you should improve it. Write first in your native language, go to classes of scientific writing. There is a lot of work and despair in publishing, but there is no better feeling than to hold in your hands or see your first publication. This is something very special. Why to publish? You will improve extremely in your profession. You will get 5 times better. It's nonsense to speak about paper tigers like many surgeons are doing. They don't accept publishing. They many times tell that those who are publishing, they cannot operate on or do the medical job. This is not true. You will improve a lot when analyzing your own material and your cases. So this is from the famous statesman, philosopher Francis Bacon, nearly 500 years ago, 400 years ago. Every man owes it as a debt to his profession to put on record whatever he has done that might be of use of others. And this is very important. We should share our experience to others. And what I have seen now in 3 years in China, it's a pity that this huge experience, skills are not better published in China, especially because of the language difficulties. You should concentrate for publishing, heavily learn English and publish, because the patient material is huge and skills are good. So what are the benefits of publishing? In the beginning, there are no benefits, only hard working, and you are losing actually money. You don't have private patients. You cannot do extra job because the writing is not paid. But for example, in my case, with this book and around 100 publications done before that, I became professor and chairman in Helsinki, 97. And with this book, Helsinki, Neurosurgery, translated in many languages. So I became world famous and got, for example, this working place in China. So there are many benefits. Benefits might become late in positions and pay back also in money. So I will give now the word to Giuseppe Lancino, who is extremely skillful in publishing, writing, writing and publishing. So we should follow his advices. So please, Giuseppe, go ahead.
Thank you. Thank you for the great introduction. It's for me, it's a pleasure and an honor to be here with you today. And Professor Ernestiemi has summarized very well what are really the basic principles. And I cannot agree more with the fact that it's an incredible learning experience. I think it takes some of the qualities that also are required to do good surgery, because it's really a continuous hard work. To publish also makes you, forces you in a way to maximize the use of your time, because you will see there are no secrets. If you like to do it, you use the time that you have in between cases, where it's easy to sit down, get a cup of coffee and start talking with your friends. Instead, if you are working on something, it forces you to read, to really maximize and utilize every single minute of your time. And the other part that I like to stress for the younger people is how it really takes you to a completely different dimension. That when you start analyzing your material, your cases, or some of your team cases, in light of what you have read and what you have studied in the literature, and really gives you a unique perspective, where you are able to, you will notice that you start seeing things that other people might not notice, just because they don't have the same background, they don't have done the same hard work, they haven't really studied and analyzed the material as well as the literature. I will go slow, and you will see this is all about practical things. English is not my first language. I had a basic knowledge of English when I started neurosurgery in Italy. And I can assure you that you can learn to write well for scientific publishing just by studying and dissecting out and constantly reading the literature. And one of the key to success is that, first of all, you have to overcome that mental block when you start thinking, oh, maybe I should write about this. But people have a mental block where they think it's so difficult. But the key is to really keep it simple. And you will see that there is a structure, and there is a method to scientific publishing. So when should you write a manuscript? Well, of course, to write a manuscript, especially as you are starting, you need to have something new to say. And there is no question, with the flourishing of publishing, it's not that easy to find something new to say, but sometimes can be just a single case with a new particular angle that you can find. Might be for us, it might be a new technique or a modification of an old technique when you describe your modification and why might be useful in some situations. Reviews are great, especially when you find the topic where the information is sparse here and there, and you try to put together and to summarize a lot of information in a single article. And then, of course, as surgeons, really case series is is the most common material that we write about. So, but in any case, when to write a manuscript? Well, anytime you think you might have a new angle or something new, and then of course when you become Professor Ernest Yem, it's very helpful to write your own series of anterior communicating pericallosal artery aneurysm, ICA bifurcation aneurysm. If you read those papers, those are classics. Even though there might not be a lot of novelty because some of the approaches, but then you become an expert, and it's important as an expert that you summarize your observation and you can teach other people. So one mistake that I made as I was starting is that I would get very enthusiastic about an idea. I would start going through the charts, review the x-rays, and try to write the paper. And without doing the background work. And there is nothing worse than you start a paper, you review a case series, your own series, and then after you have done the review of your own series, you go back and you start reading the literature, and then you say, oh, I should have looked at this. Oh, I should have collected this type of information. So before you start, it's important to do your own homework, to really review. It's not only review the literature, it's really study the literature, study what's known on the topic. You read the one paper, you look at the references. One paper will take you to 10 more references. You get those 10 references. Then you go back to the original paper and you dissect it out and you study it. And then, people say, well, how long does it take to write a paper? Well, once you have done the work, it doesn't take too long. And you will see that throughout my slides, I will have been read how much time it takes to write certain parts of a scientific manuscript. But the thing is that there is, at least the way I do it, there is a lot of work that if I'm not doing surgery, if I'm not doing, if I'm not seeing patients, it's more likely than not, in my mind, I'm going through some projects or some, and I'm going back and forth. So there is a lot of work actually that I do as I'm driving back and forth to work, because there is a lot, if I'm walking around the hospital, there is a lot of thinking. And that's where a lot of the papers that I write really take shape. So it's important to know that there are some rules, and actually a manuscript, a scientific manuscript, has a scheme. And I strongly recommend after you hear my presentation, really I tell my students and my residents, then go and study 3-4 manuscripts that are published in the New England Journal of Medicine, and you will see, you will recognize this scheme and identify these rules. So the title. Well, what's the role of the title? Well, the title is supposed to make the reader interested in the topic that you are describing. And it's important that the title, it's a reflection of your manuscript. The title is not a full sentence. In a few words, you need to describe what is the main purpose, the main content of the manuscript. So often nowadays, everybody's busy. We don't really even get anymore the printed copy of journals, we get this mass email blasts where there are the titles of the papers published in that issue. And what we do, we browse through and we say, oh, this paper, the title is interesting. I want to look more into it. So that's the role of the title. Sometimes a flashy title might be better than plain. I prefer usually plain, simple titles where it says exactly what the paper is about. But occasionally, especially if it's an editorial or it's a review on a topic, a flashy title might be better than just a plain title. The title in today's world of computers has become extremely important because the title and the keywords that most journals require are very important in deciding whether or not, when somebody is searching on a particular topic, whether or not your paper will come up right there. So pay a lot of attention to the title, but at the same time, it's not something that you sit down and you spend hours about. The title is something that you don't need to be sitting down. It's something that you can think and rethink throughout your day. And as I said, as far as I'm concerned, usually I think about the title as I'm driving from and to work, and then I write it down, and then I change one word, the order of the words. And that's also something that it's a very important part of the paper, is that the continuous, almost I say like an artist, like a sculpture, like a jeweler, you really at the end, you go back and forth, you change the order of the words. It's a constant work trying to get it as perfect as possible. So this is, we wrote a Neurosurgery in the 90s, was asking for a review on different areas of neurosurgery. And here we wrote about neuroendovascular therapy, and you can see the title is Treating Complex Nervous System Vascular Disorders Through a Needle Stick. So just an idea of a little bit of a flashy and different title. Now, the abstract, I will come back to the abstract later on, because the abstract actually, it's easier if you write at the end, when you have the final product. But in any case, most journals nowadays, they will give you precise instructions about the abstract. Now, do not underestimate the abstract. The abstract is actually the most important part of your paper. The abstract is the part of your paper that most readers are likely to read. Most readers, they look at the title, they think, oh, gee, this is interesting. They look at the abstract, and sometimes, nowadays I'm reading through during the day as I get an email about some journals. I read, I pull the abstract, and I go directly to the conclusion to trying to understand what the paper says. So you do need to be very clear about your abstract, because you need to you need one sentence to introduce the topic. Basically, why did you do what you did? And then material and methods, very briefly, you have to summarize the main material and methods. In the results, you have to, again, every time you write a manuscript, you are lucky if you can make a 1, 2, at the most, no more than 3 teaching points. And therefore, in your abstracts, you focus in the results section, you focus on those one or two major teaching points. If there is, if you use statistics, you give statistic, you give p-values, and then you need the conclusion. And it's important that your abstract is a faithful reflection on what your paper is saying. Too many times you read the abstracts as a reviewer. I read the abstract, then I read the material, the results, and the discussion. And the abstracts are, the abstract is saying things that are not necessarily what the entire paper is about, or what. And there are words limits in the abstracts. And really, as I said, the abstract, you write the abstract once you have everything else. And once you have everything else, it doesn't take more than 1 hour, because the introductory statement and sentence is going to be part of your introduction. Material and methods and results are going to be part of the text of your paper. So in the abstract, you just need to really summarize, and then the conclusion will be the conclusion of your conclusive statement of your paper. So it's much easier once you are done and you have the final product, then you go back, look at the journal instructions, and just write down your abstract. So we touch about things. It's you know, the most important part of your manuscript. It might be the only part of the paper that most reader will actually read. Now, the introduction. Introduction is very important. It's very important for the writer, because I see that too many people make a big mistakes, and that is to spend too much time on the introduction. The introduction, it's not meant to be a review of the topic you are talking about. The introduction has two goals. Number one, you have to basically, in the introduction, you tell the reader why you did what you are going to talk about. And number two, you make the reader interested in your topic through the introduction, so that the reader is likely to say, wow, this is interesting. Let me read more and see what these people find out. And the other very important, so the introduction, really, you don't need to spend a lot. And the other thing to understand is that, again, there are schematics on how to write a paper, and the introduction follow a funnel structure. And I will show you what that means. And after you hear this, again, I strongly suggest take an issue of the New England Journal of Medicine. Look, they publish 3 original articles per issue. Look at those articles and identify this structure. So the introduction actually should not and does not take a lot. Once you know why you did your study, and once you have done your homework and you have a good knowledge of what's known, then you should, it should not take really more than 1 or 2 sentences. Remember, space comes with the price. Journals and the readers, they like very succinct, to the point manuscripts. When I started, I made the mistakes that I thought that a manuscript, to be good, you need to be long. Instead, it's the opposite. The better, the shorter the manuscript, the more to the point, the better it is for the reader, as well as for the journals that hopefully is going to accept your manuscript. So the Goal of the introduction is that why it's important to worth reading what you are doing. Give some credit to the audience, give a brief acknowledgement of what is already known in this specific field. But again, the introduction is not meant to be a review on the topic. So don't start with the entire history. If you're writing a paper about MRI, don't start about the entire history of imaging and X-ray. And here is the funnel structure. So what that means that you start with the single broad statement, often obvious. And I will show you an example in a few slides and then as you go, we saw you start with the broad statement. And as you go to the next sentence, you narrow the focus until you get down to the point is that you say, and the final sentence is, in this article, nothing wrong in saying in this article, in this study, our goal was to assess this, and that. So again, it's not meant to be a review of the literature. You should mention a couple of highly relevant and closely related papers to the topic. And then, as I said, the last sentence, you define in this study or our goal in the current study, and then you introduce your work. And basically the last line, the last sentence of the introduction is really nothing but restating what is the purpose statement that is often required as a first component of the structured abstract. So let's, here is an example of a funnel structure in a study I wrote when I was a resident. We had over a short period of time, 3 patients who came in with a ruptured arteriovenous malformation, and 3 young ladies, and the AVM ruptured as they were pregnant. So 3 cases that each one was managed differently, because there are, you have to think about the mother, you have to think about the fetus, you have to think about when the rupture occurs, first trimester, just 1 week before the scheduled delivery. So there are so many components that these 3 patients, they came all relatively close together, but they were managed differently. So how can you make it interesting to read about 3 patients with ruptured arteriovenous malformation that were managed in different? So this is the introduction of the paper. So this is the title: Arteriovenous Malformation that Ruptured During Pregnancy, a Management Dilemma. And this is the introduction. So you start with the broad statement, but that it applies to the topic you are studying. So rupture of an intracranial AVM is a rare but serious condition that can occur during a pregnancy. So this is a broad statement. No need to reference this, because yes, AVMs, we know they can rupture, but that rupture during pregnancy is something that we encounter, but it's not that common, but it can occur. Then the next sentence, we're gonna narrow the focus even more. So when it occurs, it presents particular problems in a situation where both preservation of the mother's life and the fetus well-being are required. So broad sentence first, second sentence, you focus. And basically here you say, well, when it happens, though, there are a lot of things you need to think about. You need the preservation of the mother's life is number 1, but also you try to think about the well-being of the baby. The next sentence, so then this sentence, so now we are focusing with this sentence. What I'm trying to do, I'm trying to justify why it's important that I did what I did in this paper, which was to describe 3 cases in detail that were managed differently. So due to the rarity of this condition, only a few cases have been reported. No center has a series large enough on which to draw definitive conclusions. So here I'm saying, because this is rare, there are only a few cases reported. This was in the 90s. There were no large single center series. And therefore, basically what I'm trying to imply is that it might make sense to review these 3 cases that I will present because of the management dilemma. And here is the final statement. So this is the whole introduction of that paper. I think this was published in Acta Neurochirurgica in the early 90s. So 3 cases recently observed at our institution best summarize the management dilemma encountered in treating such patients. So again, here in 1, 2, 3, and 4 sentences, you have your introduction of this manuscript that is reviewing the issue of rupture of an intracranial AVM during pregnancy. So you see the funnel structure. You start with the generic statement, and then you restrict the focus until you come to the end, and the end is say, in this study, we did this. And it's a fairly simple, very standard, the last sentence, and this, in the present study, we reviewed this for this specific reason that we just mentioned. So you can see the introduction. Once you have thought about the study, you decided why you are going to write this paper. You have studied the literature, so you know the 2-3 main references that apply particularly to your topic. You justify why you did what you did. It should not take too long. Again, it's not intended to be a review on the topic. That's the most common mistakes that when I review a paper, I see from investigators. And to tell you the truth, if I'm a reviewer, I hardly read the introduction, because the introduction doesn't tell me anything. And again, it should be really focused. As a reviewer, should be really focused. Material and methods, well, for the type of papers and manuscripts that we write in neurosurgery, material and methods is that once you have done the work, you just need to describe in a sequential and logical way exactly what you did. So you describe in a detailed fashion and logically and sequentially the methods that you used. If this is an experimental study where you're doing an experiment, so truly experimental basic research study, the material and methods are the most important part of the manuscript. Because if it is an experimental study, what you want with your material and methods description, you want to do it in a way that another laboratory, just by reading your material and methods, is able to exactly duplicate your results. From an truly experimental paper, the material and methods are also very important, because that if your material and methods are sound, then your results will support your conclusion. But if your material and methods are not sound, then your results might not necessarily support the conclusion that you are trying to make. So material and methods is really one of those things. Is just don't think about too much. Once you have done the work, or once you are conceiving an experiment, you know already what you are going to do, the sequence. You just sit down and you write it. And it's 1 hour at the most. The beauty of the English language is that it's a practical language. You can, in Italian, for example, you should be careful not to use the same word in the same page. It's a much more complicated the language when you try to write down. But scientific English, it's very practical language. Use short sentences, and you can repeat the same word for the sake of clarity, even on the same line. So material and methods, once you have thought about the paper, you have thought about the materials, you just sit down and you write down exactly what you did. More importantly, be logical and consequential. So write down in the sequence that you did what the experiment, or how you analyzed your data. Results. So as I said, if you are writing a manuscript, you have one, maybe two. If you have 3 teaching points, that's already too much. So you need, in the results, you need to focus on what are the most important aspects of your paper. If we're writing a paper about patients with ruptured anterior communicating artery aneurysm, I would say in this series there were 20 men, 50 female patients with the female to male ratio of this. The mean age was this. And then, for example, if you're looking at risk factors, you don't need, the results is not a phone book. You don't need to list everything. Let's say we're talking about rupture anterior communicating artery aneurysm and risk factors in these patients. Then I would say the most common risk factors were hypertension and smoking, present in 45 and 30% of patients respectively. And then I would say a detailed list of all risk factors and their incidence is summarized in table 1. So in other words, in the results section, it's very important that you refrain from making a list of every single results, and because then the reader and the reviewer, they get dizzy. You just state what are the most important results that you have observed. And for all the details, nowadays you can say the details of patient demographics are provided in supplementary material 1 or in table 1. So use a lot of tables and figures to detail your results, but in the actual text, just focus on the most important messages. And when you do that, report the results in an organized and logical fashion. If we're talking about patients with ruptured anterior communicating artery aneurysm, we'll talk in the results, we'll say these are the demographics, these are the most common risk factors in these patients. Then you want to know how did they present. So the WFNS grading scale is detailed at admission, is detailed in table 2. What is the next thing? The next thing is that how did you treat these patients? Well, the majority of patients were treated with surgical clipping, parenthesis 25.75%. The remaining treated with coiling. And then what's the next thing? You say, well, what was the condition of these patients at discharge? And then you can say at discharge, the majority of patients had the modified ranking score less than 3, in parentheses 75%, and then you can say condition of patients at discharge is summarized in table 3 and so forth. So you go demographics, risk factors, clinical presentations, treatment, outcome at discharge. Then of course the next thing is going to be clinical follow-up and radiological follow-up for that specific subset. So be organized, be logical, do not repeat in the results what's already in the material methods, never give results in the material and methods. So follow the structure. And again, use as much as possible figures, tables, and graphs to summarize the details of your results. And in the text, focus only for the most important aspects. And now you know that if you have done the work, when you sit down to write the results, really should not really take too long, because it's mostly it's in the tables and in the figures, and the actual written part, it's a very small part of the overall results. And whenever you know, for a reader and for a reviewer, if you say, let's go back to our hypothetical paper on ruptured anterior communicating artery aneurysms. If you have that you say 22 patients had a good outcome, well, by the time I'm reading 22, I already forgot how many patients was the total. So make sure that if you give a numeric value, you also associate it with a denominator or the percentage. Now we go to a very important part of the paper, that is the discussion, where again, as beginner, we make a lot of mistakes because we think it's such a complicated thing. We write pages and pages and we go back and forth and it's disorganized. Well, the discussion has also a structure, as a scheme to follow. And the formula is very simple. So you have one paragraph and you say what you find and why what you found is important. And then the next paragraph is what have others found and why are your results better, different, or confirmatory on what others have found. And this takes no more than 1 or 2 paragraphs. And then the third paragraph, the third part of the discussion is that you need the limitation. And nobody better than yourself should know what are the limitations of your study, the limitations of your paper. Once again, after you hear this lecture, I send you to study 3 original articles published in the New England Journal of Medicine, and you will see that most of the times the discussion follows this particular formula. And I will come back on this formula because this is the key to understand it. And then you can conclude with, based on what we found and what is known in the literature, this is what I think should be done next. So for the discussion, let's imagine that we are writing a manuscript on MRA versus catheter angiography to follow up aneurysms after coiling. And we have found that the MRA is as good as catheter angiography to identify residual recurrent aneurysms after coiling. So how do we start our discussion? Very simple. we start our discussion that in this study, we demonstrated that as compared to conventional angiography, MRA is as accurate in detecting aneurysm remnants. Then we go on to give specifics about our findings. When we compare, we asked 3 investigators to grade conventional angiography and MRA after calling in the same patients. The area under the curve, the value that is used to indicate concordance among different investigators was. So that's how you start your discussion. Basically, you say and you state what was the main finding of your study. And as I said, usually you have 1 or 2 points. It's really difficult. Then in a paper there are truly more than 1 or 2 really important messages. And then you go on to say these findings are important because patients might be followed without the need of an invasive study like conventional angiography that also is associated with the extra radiation. So this is our first paragraph of the discussion. Nothing really complicated. As I said, remember, keep it simple. Then we go to the second paragraph. The second paragraph is that let's go back to the literature and see what other authors have suggested, and we can say previous authors, using a retrospective analysis. So here we want to stress one thing. Previous authors have concluded the same thing, but those were retrospective analysis. Indirectly, we are saying our study adds to the literature because the studies, the same conclusions other authors had reached on retrospective studies, we have been able to achieve the same conclusions in a prospective studies. And then we go on comparing what is known with our findings, and then we can conclude say our study adds to the current literature by providing a large prospective series, which confirms and provides a stronger support to previous findings. And then in the third paragraph of the discussion, then we have to say what are the limitations. And here, this is very important, the limitations. Why? Because you should be critical enough of your own study to know exactly what are the limitations and be honest about. But then you can counteract. Yes, the reviewers were not blinded. Nevertheless, this was a large prospective series, basically, again, as opposed to the retrospective series available until now. So you mention your limitations. You can mitigate with some stressing some positives of your studies. But this part is very important because as a reviewer, I cannot say, well, this study is no good because the readers were not blinded. Wait a minute. The same authors are telling me the readers were not blinded. So we know this is a limitation. So as a reviewer, I can say if the authors recognize the limitations. As a reviewer, I can say, is the paper good or not? Does it add to the existing literature? Yes or no? Did I learn anything? So this part is very important. And again, if you go to New England Journal of Medicine, you will see most of the papers, they follow this exact same schematics. And then again, with this third paragraph, you diffuse some of potential attacks by the reviewers and educate your audience. Now, the discussion, it's important to organize it. You know, it's you can put together what you like to say. Again, first paragraph, what you find, why what you find is important. Second paragraph, how what you found is different or adds or contradicts the existing literature. Third paragraph, what are the limitations of your study? So it's important that you organize it. If it's a little bit too long, which again, I would discourage you to be too long, because space comes at the price. And unless you have something extremely important to say, be succinct and short. It's very important. But if you need, you can use subheadings, subparagraphs, so that it gives the idea that it's well organized. Just discuss the main findings of the study and how these findings relate to the existing literature. You do not need to do a review of the topic in the discussion. Its discussion is just to discuss your results in view on what is known, and then at the end, identify the limitations of your study, and then at the end, propose a next step. Avoid the long sentences. As I said, the beauty of scientific English is that it's a very practical language. And believe me, you can learn it by just reading and rereading and studying well-written papers, because then the way you write the papers, as you can see, there is a schematic. There is a skeleton that you must follow. But also the language at the end, the scientific language, even the scientific language as a scheme in a way, and it's a pretty standard language that is used. It's not that complicated. Be clear and specific. Make sure that you can express. Don't make the mistakes of thinking that the reader is thinking what you are thinking. It has to be extremely clear, extremely spelled out. I read my papers not when I'm nice and relaxed and everything is quiet. No, I read my papers in the evenings as my kids are watching TV or doing their homework. I'm there trying to, keep myself updated and reading the literature. So there are a lot of distractors. We rarely have the luxury nowadays to sit down, concentrated, fresh, and read the paper. So be as clear as you can. Recognize the weaknesses of your work. You know what's strong and what's not so strong. And because if you recognize, then the reviewer has to say, did I like the paper? Yes or no. But if you don't recognize the weakness of your work, reviewers often have a mindset that in order to be critical, they want to find potential negatives in the paper. Reviewers don't like to say, you know what, this is actually a pretty good paper. I would just accept as is. Because if you do that as a reviewer, there is this mental block that the editor might think that you have reviewed the paper, but only in a very superficial fashion. So make sure that you are clear about what are the weaknesses of your work. It also helps in the discussion to mention the limitation so that you can help other people who might want to research on the same topic and make advances by trying to correct some of the weaknesses of your work. Of course, emphasize the strengths, because that's what will make the paper published, and nothing wrong with trying to be persuasive to get your point, as long as it's adequately supported by the fact and by sound methods. And then after those three paragraphs, there is a conclusive statement that basically says, in this study of 200 patients with ruptured anterior communicating artery aneurysms, we found that age and the projection were the most important factors predicting both clinical outcome and radiological complete occlusion, something along those lines. Now, as I said, the discussion can take quite a bit of time, and it should not be more than 2 to 3 double-spaced pages. And it might take, just to write it down 1 or 2 hours per page. But I will touch upon the fact that then the very important phase of the paper starts once everything is in writing. So what you should not do in the discussion, do not start with an extensive literature review. Do not repeat what you already said in the introduction. Do not restate completely your results, but as I said, the first statement restate clearly what are the 2-3 main teaching points without using too many numbers. And again, do not stray away from your teaching points, because that's really the main beef, the main meat of your paper. That's what's going to decide if your paper is going to be accepted or rejected, is what are those 1, 2, at the most 3 main points that you are trying to make. Again, do not try to do a full review of the topic, and focus in the discussion on those 1 to 2 teaching points. When we sit down with my fellows or residents or students and we are writing the paper, I sit in front of them and I say, okay, you know the results, now tell me a story, basically. And they start talking about it. I say, no, tell me a story about what you find. Why should I keep listening to you? Why do I need to sit down and make sure that I listen what you are saying? Make a good, logical, and convincing story based on what you found. Now, people are busy. They don't have time to read a lot. Very few people now spend really hours a day reading professional journals. So you have just 1 or 2 points at the most to make in your paper. And just again, I cannot stress enough, keep it focused. Now, some general principles. Avoid being redundant. Each abstract, introduction, of course, in the abstract, you are summarizing the entire paper, so you can repeat what you said in the introduction, material and methods, results and conclusions. But in the text of the paper, avoid repeating in the discussion what you said in the introduction. Results are results, and they go in the results sections. They don't put results in the material and methods. Do not put material and methods in the results. The material and methods and the results, you cannot comment, you cannot make any editorial comment, because those are intended to be a pure description, the material and methods on what you did, how you did it, and the results, a pure description on what you find. Now, here, if you're going to use abbreviation, use abbreviations that are very well known to your peers. Do not make up new abbreviations, because as a reviewer, as a reader, again, I might read the abstract, and then if I'm interested, I jump to the results. But if in the results I start finding crazy abbreviation, and then I have to go back in the text of the paper and every time identify that first sentence where that abbreviation is used, I get tired, I get dizzy, I lose interest. And the same thing as a reviewer, it makes it so much more difficult to review a paper if the authors are using all these abbreviations. Just to use only those abbreviations that are very well known to your peers. For us, SAH for subarachnoid hemorrhage, ICH for intracranial hemorrhage, MCA for middle-cerebral artery aneurysm, maybe UIA for unruptured intracranial aneurysm. So use and stick to those abbreviations that are well known, that I don't need to, every time I found in the text, I don't need to go back and identify in the text where that abbreviation was first used, because it makes it more difficult to understand, more difficult to follow, more difficult to jump from one part of the paper to the other, which is most of what we do as readers. You know, we rarely read or study a paper unless, truthfully, if it's a truly landmark one, or if we are studying that paper as part of one manuscript that we are writing. And, you know, like well-written papers, when I see a well-written papers that follows this scheme and is clear to the point, and I can tell what the authors are trying to say, there is no question that the reviewers and editors, they like it. And because then you can only say this paper is well written, then I have to decide, does he have a new message, yes or no? Is appropriate for the journal, yes or no? But I don't have to write 50 pages of a review to try to correct or to reorganize a paper that has not followed exactly that scheme. And as I said, the main mistake I made when I was young is that every paper I thought it had to be longer to be good. Look at this. This is Watson and Crick description in 1953 of the double helix structure of a DNA. And this is the entire paper. So, and this is probably the most impactful paper that has ever written. So you don't need a long manuscripts or fancy figures to, you know, to really make a good point. Figures. Couple of practical things. This is what's wrong with this figure. Do not abuse the legend. You know, when I'm looking at the figure, I like to have quickly a clarification on what the authors are trying to say. But if I have to read this legend, for me, it's like studying a textbook. You know, just to be concise in your legends and in the figures. Never, ever assume that the reader, no matter how expert that reader can be, do not assume that the reader is seeing what you are seeing. Because in the figure, you're seeing the aneurysm, you're seeing the subarachnoid hemorrhage, but you have looked at the figure, you have taken care of the patients, you have written the paper, so you know exactly where to look. But the reader use arrows, use asterisks to identify important and even obvious parts of your figure. Professor Ernest Yemi mentioned about this, very important. Do not copy, and you know, you can use some papers as an inspiration. This becomes also an issue as you publish more and more. You know, the way if I'm publishing 10 papers on different topics on aneurysms, well, there's going to be some sentences that are probably similar between the different papers, because that's my way of communicating, that's my language. So, but in any case, of course, you know, there are a lot of softwares, run your paper through a software before you submit, to make sure that there are no commonalities with other papers that have been published, because this can be a career-ending issue if it comes up. We talked about the figures, references. Well, I think references are very important. You need to have very important references. Reviewers, if they find out that you missed one of their publications, they'll come back and they will notice. So make sure that you don't miss, papers. And the other thing is that make any effort. Nowadays, despite the computers, it's surprising how important papers that were published 20, 30 years ago are not cited. And that gives you, as a reviewer, gives you a bad taste, because I start thinking, well, these authors are inexperienced or are superficial. So again, you don't need hundreds of references, but make sure that you have the relevant reference and that you properly reference people who are expert in the field in your topic. Now, this is the most difficult part. When is a paper done? Well, a paper is actually done only once this is in the old days, once in the mail. Nowadays, once it has been submitted, approved, and you get the notification, your paper now is in the review process. But the truth is that it might not take too long to actually write the paper, but figures, legends, references take a lot of time. But remember, these are tasks that do not require a lot of intellectual. It's not writing the discussion. So these are tasks that you can do in between cases, or while we are waiting for your postoperative CT scan to be done, or you're waiting for a transfer to come in, and so forth. So there are tasks that take a lot of time, but they don't require a lot of concentration. So those tasks can be easily done during a busy day, because during a busy days we often have some degree of time that we might not utilize. So a common mistake is that the paper is done after you have put your thoughts together on a text, but actually most of the work is done after that. You read and reread your paper, you make correction, you change the order of words, you change the order of sentences. And there is often a stage when you get discouraged. You say, "Wow, this is really, what am I saying here? This is really not worth." And I waste a lot of time. Don't get discouraged. This is actually not an uncommon reaction. Just improve your paper, but at one point you need to make a decision. Okay, now it's as ready as I can get it, needs to go out. And but there is no question that once the paper is quote unquote ready, there is a lot of work of revising, chiseling, moving one word, changing one word, rechecking one reference. And that is the work that is critical in making it as good as possible. But you cannot be a absolute perfectionist, because otherwise you will never send that paper. So always important to find that fine balance, but there is a work. I after a paper is ready, if I really want to make it as good as possible, I reread it and reread it, and often I read aloud at least 5, 6, 7 times, and make tiny little changes if something doesn't sound correct, or something it's not quite as clear as it should be. And it takes I realize, you say, why it's so easy, why is not more people actually do this? Well, it's because It has a scheme, you can learn it, but really to take it to fruition, it takes a degree of perseverance and tenacity that most people probably don't have. But you know, I view this as a tough surgery. You know, if you give up, you lose. But if you keep working hard and you are careful and you try to do make everything perfect, more likely than not, you're gonna win. So I view every single paper as a challenge and as a way to you in a way test my perseverance. So as I said, but you have to be careful not to be a perfectionist, otherwise you will never submit a manuscript. And that's one of the problems with a lot of really good people. At one point, you just need to get that, send that thing and get it out. If you get a paper back with the request of additional revisions, that's a great sign. You know, revisions, unless they're asking you to redo the experiment, well, that's often an unreasonable request because you are done with the experiment, you moved on. But the revisions, usually, if you can answer, never argue with the reviewer, answer very politely to revisions, point by point, and make the best. That's usually a good sign. The paper is likely to be accepted. Once you get the request for revision, don't put the paper in a drawer. Don't wait months. Get it done as quickly as you can, because the longer you wait, the harder it gets to do those revisions. So some practical suggestions before we conclude. I use some psychological tricks. As a matter of fact, once I have the title, I put the title page with the authors, my name, the affiliation, corresponding author, and just seeing the title page with my name there, it gives me that boost and that sense of this is something real. Even though I might not have the remaining text yet, it's something that psychologically makes me commit to do it, and also gives me the boost that this is something that it's going to happen. Don't wait for the perfect time. I still make the mistake. I have something in my mind, and there are things that I've been thinking for 5 years, and I say, you know, one day I'm going to take a weekend and I'm going to get it done. There is really no perfect time as a surgeon to write a paper. You just do, and that there are no secrets. Most of the work is done on nights and weekends. I don't know if the slides are going to be available. This is very useful, this table, because it basically summarize exactly what I said, and it's the key to success is to really keep it simple. And once you memorize that structure and you understand the structure and you stay within that structure, the text itself, it's actually not that difficult. But remember, do your homework, review the literature before you sit down and do the experiment or review your series, and then write it as clearly as possible, and make your point, and keep it simple. As I said, it's hard that one paper has more than 1, 2, at the most 3 important teaching points. Thank you very much.
Okay, Juha? Well, thank you, Dr. Lanzino.
Thank you.
Go ahead, Juha. Go ahead.
Thank you very much, Giuseppe, for this wonderful teaching. I really hope that I had listened this lecture 45, 50 years ago, I was really struggling very much in the beginning with writing, and I remember extremely well when I sent one of our first honors papers more than 40 years ago. It was a huge series that time, more than 1,000 pages. I sent it to Journal of Neurosurgery, and that time the chief editor, John Jane, sent me a letter. Unfortunately, this beautiful series is so badly written, we cannot accept. So I was so disappointed, so disappointed. I had tried so hard to make it good, but he was right. It was very badly written, and we rewrote and published in another journal, but this was good teaching. So we learned it is struggling, and many rejections and many times changing the papers, and then finally accepted, and then we learned to write. So finally we could get most of the papers accepted without any big changes. So I really wish I would have listened this wonderful lecture so many years earlier. I hope this can be saved in the YouTube so that all those who are interested in writing scientific papers can always repeatedly take a look on it. So thank you very much, Giuseppe, and the word is open now.
Thank you. I just like to say that it's great, and really you many years ago opened my eyes to what I had already observed. There is great work done in corners of the world you would not expect by people that you might not have heard. And it really breaks my heart that we don't know more about so many colleagues that do incredible work. And one of the main reasons is that there is this block about publications that it should not be that, again, it should not be as difficult as it is perceived. And there is so much now with the webinars. It's great. We can learn more from a lot of colleagues, but there are so many things that are seen around the world that we could all benefit just to know more.
Juha, can I make a comment?
Of course, please go ahead.
Yeah. So, you know what, Giuseppe was talking on a subject which is very difficult to talk and very difficult to teach anybody how to write. Because writing is not, it comes from within. It is nobody can actually teach. But what Giuseppe has presented, minus small subtleties and tricks of how to make papers and how to write, are really incredible lecture, I will say. So as far as I am concerned, and we all know that writing is important if we want to go beyond the line. If we want to become good neurosurgeons, we can be a good neurosurgeon. But if we want to spread the message, if we want to become widely accepted, we have to write, because unless we write, how will others know what is our level? And my feeling is, even if you are a young resident, even if you are a young student of neurosurgery, and if you, whilst operating, you think that you have got a new idea, you have taken a stitch which you think that you have taken it for the first time, or if you have done a graft and you think that nobody might have done this, or you might have done a bone flap which you think this looks unique. So don't underestimate your own idea. You have to go and immediately go and rush to the computer and identify if that idea has been used by others, have been deployed by others. It may just be that nobody has ever done it. So it is a good time to immediately go and start writing and produce a paper. So small ideas should not be discredited. You don't underestimate your own capacity and own potential. So my feeling is paper writing is an art. But what is more important is to do good neurosurgery. And good neurosurgery, you get ideas. And when you think you have got a new idea, you try to publish it. Publications are based on ideas, as Giuseppe has mentioned, that if you have an idea, you can publish. It is not your English should be good and very good. All of course, your English should be reasonable and good. But what is more important in writing is your idea and your thought. If you have an idea, if you have a thought, and if you think you can contribute with your series, with your work, and give your work to the others, where your thoughts and your work is having some impetus. You see, just to increase the literature and go on piling up the literature is not an idea. Is not the idea of writing. Idea of writing is to introduce something new for the world, introduce some new concept for the world, introduce some new philosophy for the world. And on the basis, if you have, like in China, you have experience with 10,000 cases, 5,000 cases. If you have an experience of 5,000 cases with an entity, which may be in other countries, that experience may not be possible. So, from that big experience, you give your thought process to the others who may not have that kind of experience as to how this entity can be treated better. So, when you are writing, writing is an art, all right, but writing is the height of your neurosurgical profession. How far you have gone into your neurosurgery, how much you have gone into the depth of the subject, and how much you think you can be contributory to the society of neurosurgery. It is not just the way you write, it is the thing what you write. What is the power in your presentation and publication? If you have power, if you have a concept, it will be accepted. The other thing Giuseppe said is, you know, how to get the reviewers interested in your publication. And there may be a set of reviewers who will say, oh, what nonsense publication, and they reject it. So if you think you have the power, if you think your concept is good, don't get disturbed or terribly upset by that. Immediately, my feeling was if my publication has been rejected, I used to what my thought was on the next day it should go to the another journal. And one journal says very bad article, other journal may accept it and say what good article. So don't get disappointed by rejection. That is another thing. You do hard work, you do correct work, you do systemized writing, you produce a novelty, you produce a good technique, you produce a concept, you produce a philosophy. If it is rejected, don't bother. And you must also know Giuseppe is working in one of the leading institutions of the world. As Yuha was mentioning the other day, from a country like India to get your articles accepted is not easy, and it is not easy or maybe impossible to get your good big length article accepted is quite an impossible job. But if you lose patience by, if it is rejected, you just get disappointed and stop writing and all those things. Yeah, these things should not be at all there. Be persistent, be patient, and be positive. I think those are the hallmarks of people who want to grow beyond a line. Because, as was mentioned, publish or perish. Maybe if you don't want to, you can just do good work, good neurosurgery, help your patient. That is the job of a neurosurgeon. Of course, that is our life. But if you want to go beyond a line, you have to publish. And you have to publish in journals which are recognized, which are more widely circulated, which are more widely read, and which accept your thought. And maybe if your thought is beyond a point, it may be recognized and people may start doing your technique or your concept may be followed. I think all young people listening to Giuseppe's lecture should get stimulated. I know Giuseppe is out of the world. Means I have never seen a person like Giuseppe who can stimulate you. You work with Giuseppe for 10 days, you get stimulated. I had an opportunity to work with Giuseppe for 1 year, and I think Giuseppe stimulated me, introduced me to the art of writing, to the world of writing, and I have gone, whatever distance I have gone is due to the publications. And I think this presentation should be kept in mind.
Excuse me,
And
Atul. Atul, can you tell when you first met Giuseppe what the setting?
yeah, Giuseppe had, just finished his medical school, and he was, in his mind was completely not sure what he wanted to do in life. So he came to Pittsburgh. We were working in Peter Janetta's and Laligam Shaker's department together. And he was a young, very handsome Italian boy. He's still handsome, of course, young. But what he was, in Italy, he was not too happy, probably. And he wanted to make his roots set in US. And he wanted to write. And he wanted to just write. And working day and night. We used to work, of course, Giuseppe used to work all night, collect material, read so much. He was just a medical student, and he came into high profile neurosurgical department. From medical student to high profile neurosurgery department was not easy transition or simple transition. And in this high profile neurosurgical state of art technical department, to produce papers which are still referred was not an easy job. I think the persistence, the hard work, the unusual, unbelievable kind of commitment to the subject and to the art of, not to the art of writing, to the subject of neurosurgery. And then he made roots into American system, went into Virginia with John Jane, then went into special department, then went into interventional radiology, then to do both neurosurgery and interventional radiology, and then doing good in both, then getting into Mayo Clinic, and then you see where he is. I think it has been a great companionship with Giuseppe, and I feel honored and proud to have an associate like Giuseppe throughout my life. We still communicate with each other all the time. And I have no hesitation to say that Giuseppe can stimulate even a stone to build, articles. Even stone can shake when Giuseppe is around, the way he walks, the way he talks, and the way he produces. He's a real gem and a real, what I should call, not gem, of course, but a real stimulator for young people. And in whichever department he will go, make that department shine. So
Thank
that
you,
are,
Atul. Thank you, Atul. Thank you very much. More comments from the panel?
I like John. I like
Sure.
to say, first of all, Atul, thank you so much. That's don't get discouraged. The number of publications doesn't mean much. So, but even myself today, my students ask me, we should submit this patient a paper. Of course, I have some ideas. It depends on the topic of the paper. But I can tell you that today, I cannot predict which paper is going to be accepted and which one is not going to be accepted. So don't get discouraged, because the process of peer review, we know it's not perfect. And I get papers accepted in journals that I thought that, maybe the paper was not that great for that particular journal, or vice versa. And so that's one thing I tell my students, say, well, let's be reasonable, but then let's have the reviewers and the editors make that choice whether or not they want to accept it, and don't get discouraged. It is true, there is no question, some of the best papers I've written are in journals that might be even difficult to find. And they were written when I was still in Italy. So there is no question, nobody better than myself recognized the fact that it's much easier to publish from some places than others. But being on the editorial board of several journals, I know very well that finally today there is a recognition. The world is a big place. And there is a lot of interest from editors and journals to give a voice to as many people as possible from all different parts of the world. The main issue is that you need to communicate. And, when you get a paper as a reviewer and it's very difficult to read, then it kind of often breaks your heart, because you can tell that there might be a message, but if you cannot even understand what the message is, it makes it very difficult. But do not get discouraged. Believe me, you can learn it. I started like most of the young people on this webinar. I had the basic understanding of English. And I was telling John earlier on before we went live is that for me at the beginning, learning how to write was my token of exchange. I was in Italy and, in the European system, senior people don't spend a lot of time teaching you how to do surgery. So for me, say, look, I will review your series. I will help you write your paper. This is my token of exchange. Then you spend a little bit of time teaching me how to do surgery. So that's actually how it all started, and it motivated me immensely to learn how to write. And the way I learn is by reading thousands of papers. So it's doable.
So, something more? Read up? How do you feel now?
Go ahead,
Yes,
Radab.
Dr.
Go ahead, Radab.
Thank you all. Thank you, Professor Lanzino, for this remarkable presentation. Actually, you just made a changing point for all of us. Thank you, Dr. Joan and Professor Juha and Professor Atul, specifically for this consistent educational platform. It's just invaluable platform for all of us. And no comments, actually. Dr. Lanzino took more than we needed at this time. And we all wish that we one day will be just close to his positions and have great contact with him. So thank you all. It's an honor always to be with you. And I wish you all be safe. Thank you, Dr. Juha. Thank you, professors. Thank you.
Thank you, Radab. I think Mohammed, you have a comment? Mohammed Helmi.
Yeah, thank you, John. Thank you, Professor Lanzino, for this remarkable lecture. Actually, I have two questions. The first one, what is the role of the co-author in writing the paper? The second question, which I would like to hear the answer from Professor Hernasnemi and Goel about it. My second question is, if you have two good ideas, the first one is about research and the second one is about clinical research, which one will you start first? Thank you.
My principle has been always that everyone who has been contributing to the paper is inside the soccer team, like we called it. There was a flow of people in Helsinki, so we try to give credit to everyone. Of course, it was sometimes difficult, but the main, I think this is very important, because you will be extremely disappointed when you see a paper and you have been contributing and then you don't see your name there. This will make very big personal fights and you will never speak with those people who have made that kind of mistake. So this happens, and then there is, of course, there is a big fight. Who is the first author? Who is the last author? That kind of fights might occur, and they are seldom spoken, but they are very common all around the world. And I think important to give credit to everyone who has contributed to the paper, and then before the paper is done, to negotiate who is the first author, who is the last author, or who are the first three authors, and so this, otherwise when you're at the final stages, then you begin to fight about that, then it will be difficult. Yeah, there are many difficulties that are not commonly spoken. These are coming from our weaknesses as human beings. But give credit to those people who have contributed in the paper.
Okay, very good. We have a comment from. Oh, go
John,
ahead.
just-
Go ahead, Atul. Go ahead.
The main, the number one is all authors are important, and all those who have contributed must be included in the authorship. Number one author is the most important, and the contributory means the address for correspondence, the one who corresponds with the journal. So the one is number one author, the corresponding author, the second author is important, and the last author is important. Usually the senior most person in the list will be the last man, but that does not mean he's the least. His last author is sometimes considered to be very important. Some senior people like to put their name in the last, and some people who write the most part written are the number one. So my feeling is, if there are two authors or three authors, the paper has little bit less power. If you have 10 authors, the paper may have a little bit more power. So if you have 10 people contributing to the production of the article, you should write all 10 names, because if you have more authors, it gives more power to the publication. I think second or third or fourth author is, if you have participated in the study, your name has to be there. And if your name is not there, you better keep your name there, because have a name in a publication is of great importance.
Thank you for answering the first question.
Can I speak? Can I speak?
Yes.
Thank you, Professor Johad, Dr. Ato, Dr. John, Dr. Victor, Dr. Anzino. Very nice lecture. Before there's East and West, like thinking. I read to Indian writer is very nice to us at Syria. I see, I understand more. After that, at the West writer or at medicine, especially, I read medicine. This is very difficult because classically, Indian like to make this fantastic. Make this lecture today. The article is very nice to make the who read or who listens to us to advise his mind to listen. Very good. Okay, I see East School and West School. Thank you very much for all, and Professor Joha. Thank you.
Thank you, Omar.
Thank you very much. I think we didn't answer Mohammed's second question.
Okay.
What was that? Your second question.
Okay.
Thank you, Mr. Nemi. My second question was, if I have two research ideas, one about the basic research and the other about clinical research. Which one should I start first?
I think as an active neurosurgeon, it is more easy and more close to do clinical research because this is our job. To go to deep basic research is very difficult because this is a totally different area. So I think you should select. If you want to make basic research, you have to give up a lot of clinical neurosurgery. This is simple so. You cannot do both very well at the same time. I know there are big institutions. You might be able to do that, but this is seldom. This is very seldom. So you have to devote to one of the areas. I don't know what others are thinking, but this is my feeling that if you want to be a good clinical neurosurgeon, then you do clinical research and analyze what you are doing.
See,
What are your thoughts, Giuseppe?
Yeah, I agree. Your question, Mohammed, I would say follow your passion. But I do agree with you, and I do have a little bit of a bias, is that I feel as a neurosurgeon, if you are focused and interested in clinical research, then it's much easier that it becomes a natural part of an extension of what you do every day. Experimental research is great. That's where a lot of the true major changes come from. But it's something that takes a fairly different focus level of expert. It's very, very difficult to maintain an adequate level of expertise because the language is different. And from a practical point of view, it's much easier to take a clinical project to fruition. An experimental project you start, and it's very time consuming, and the experiment might not at the end bring the results that you were aiming and you were hoping for. And so from a neurosurgeon, I think it's not, I would not say makes much more sense, because there are many colleagues that can be great neurosurgeons, and they're doing excellent experimental research, but those colleagues often they have an infrastructure, a laboratory. Now, if you can find an experimental project, I did spend at the very beginning 2 years every day in the lab. It was very useful for me because it helped me to understand the scientific language, the scientific process, but it was also very useful because every day I was doing 2 microsurgeries in the rat, exposing the middle cerebral artery and putting a clip across it. So that project, I don't think I ever actually published a paper about the work I did in those 2 years, because no drug seems to be able to prevent cerebral infarct. But it definitely long term, it helped me a lot. But from a practical point of view, in a way, I spent 2 years without having anything written down, any publication to prove that I actually did that work. So follow your passion. But as a neurosurgeon, unless you are in a situation where there are a lot of resources available, you can work with the PhDs and collaborators. It's a much more natural clinical research rather than experimental research.
Okay, more comments, questions? We have time. We have time.
yeah, Mohammed, the other thing that is important for a neurosurgeon, of course, what is important for a neurosurgeon is to work in the operation theater and produce what he sees in the operation theater. That is most important. But another thing that can be very important is your anatomical work. You can go in the lab, work on anatomy, work on middle cerebral artery, work on anterior cerebral artery on several cases. So anatomy and surgery are like complete, they work in, like brothers and sisters. Now, if you are doing some chemical experiment or some other experiment, that is not a neurosurgeon's job. You see, that there are special people who are destined and they are made for that kind of job. A neurosurgeon is life is in the operation theater and with the cadavers. I think these two go hand in hand. Other things are relevant for pure, some scientific mind. There are some people writing some, on vasospasm, like Giuseppe knows, on some kind of chemical interactions and all those things. But for a technical surgeon, like what is important is your work in the theater, how you suture blood vessels. You can go in the lab and do microvascular anastomosis from this vessel to another vessel to this vessel to another vessel and produce a paper on that subject, produce a paper from anatomical subject, work on white fibers and produce a paper on white fiber tracts. Those will be important for you to learn and reproduce in the theater. I think we have to do what is important outside, which will be relevant in the operation theater. That kind of extra work is, I think, more beneficial for you and useful for you.
Okay.
Yes. Something more?
Yeah, I want to say something.
Of course.
Okay.
Oh,
Go ahead.
thank you. So thank you very much for this exceptional talking and presentation, Dr. Lanzino. So my name is Amir. I'm in the final year medical student in Turkey and currently the research fellow of Dr. Lanzino in my clinic. I just want to thank Dr. Lanzino and say, I mean, this was very exceptional talking, and Dr. Lanzino is very supportive, kind, and a great mentor. I remember everything he said, like since my first days in Mayo. I just have one comment to add. So for the young researchers who are looking to publish and learn the research, they should look for a great mentor to guide them and stimulate them. It's very important in research. Maybe in the first day they would not find that mentor, but they have to work hard to find that one, because they can't go on without that. It's like surgery. They need for someone to teach them and show them the way. So thank you very much for organizing this webinar, and thank you very much to Dr. Lanzino for this exceptional talk.
Thanks for the comment.
Great. Giuseppe?
I think
Floor's open.
I think okay. I speak or okay. Sorry. Can I speak? I think. I think, Professor, this is very good webinar lectures, and Dr. Joha, Dr. Atol, Dr. Lanzino, very nice. I think we must research and research and research before we publish, because there's so many ideas. Because any idea, this is have at least 6 faces. Any ideas, because like box have 6 faces. You must research too much. You see the ideas from all the faces. You must research too much and be published to make the published is very obvious to the others.
Very
These
good.
are ideas.
Thank you. Thank you, Omar. Takashi, how are you doing today? Takashi.
Thank you. I'm the native
Takashi.
You are, good evening, you have Dr. Goer, and thank you, Dr. Lanzino, for a very informative lecture. I was very encouraged to write papers by learning from your lecture, and I was very stimulated and encouraged and motivated. Like Dr. Goer, like the Neurosurgery Encyclopedia, more than Dr. Goer is a modern neurosurgical encyclopedia. So I try to use that ideas and write some papers. I'm very encouraged. Thank you. Every time. Thank you very much.
Yeah, Takashi is a neurosurgeon from Japan, and he's translating into Japanese for today's transmission. Thank you, Takashi.
Thank you.
I think it was very important what Mohammed Amir said, that we seniors, we should support publishing, we should support and push the young people to write down and help in publishing articles. This gives a good experience, and without the young people, I couldn't never publish so much. So we had a good team and good young people and good ideas, so we could have the Helsinki machine, which has proved ineffective here in China because of the lack of language and the lack of scientific writing. So this is extremely pity, because in China, like Atul mentioned, huge experience in microsurgery, thousands of cases of rare diseases have been collected. So this should be written down, like Francis Bacon said in his sentence. We should write down what will benefit others in their life. So this should be written down, and also to expand our field. This is, you can tell that you have done 2,000 cases or 5,000 cases, but if you don't write and analyze your cases well, then this will not spread. You will remain a local hero, just not going out of your limits and expanding the field of neurosurgery. This is very important, so that you analyze and in the way, like Professor Lancino was giving good advice, step by step, writing down, keeping it simple, what you have experienced and what you have brought, if you have brought something new to the field. So this is very important. So the nonsense speaking of the many neurosurgeons and surgeons about paper tigers, this is nonsense. This is so biggest nonsense. There are many seniors who are compressing down every young neurosurgeon will to write down or publish something. So this should be changed very much. I hope it will be changed.
Okay, very good. I think we'll end here on that note. Excellent, Dr. Lenzino. Thank you very much.
Thank you.
Okay, thank you very much. Thank you very much.
Thanks.
So,
Thank you for Tool for coming, and thank you for all the panelists for contributing. And please hang around after the broadcast.
okay, thank you everybody. Good night.